Hi, I'm David McIntosh. I'm a paediatric ear, nose and throat specialist, and I'm here to talk to you about kids' tonsils and snoring. When it comes to kids and their tonsils, we actually don't get too worried about infection like we used to compared to a bigger problem, which is big tonsils. If the kids have big tonsils, they can affect their breathing, which can affect their sleep. If they have trouble with their sleep or trouble with their daytime function, and they find that the kids are snoring or mouth breathing, it may be the tonsils are a problem. When it comes to tonsils, we think that for things such as ADHD, for example, it might be that up to 25 to 50, maybe even 50% of kids with ADHD have problems with big tonsils. So I just want to show you some simple pictures of how we look at tonsils in terms of their size, and this will allow you to go check your kids out. Grab a torch, grab a toothbrush, look inside their mouth, pop the tongue out the way as best you can, have a look at the back, and if you see anything that looks like these pictures, check their breathing. What you want to know is, are they snoring? Are they waking up tired? Are they grumpy? Problems with things at school? If that's the case, and they've got big tonsils, you might want to go and see an ENT. And by the way, don't worry about tonsillitis. Most kids these days, when we're taking their tonsils out, it's not because of tonsillitis. So if you're told, oh, they haven't had enough tonsillitis yet, it doesn't matter. Find yourself a doctor and a specialist that know about kids' tonsils and get them sorted. Anyway, here's some pictures. So, simple diagram here. Okay, just to orientate you, this is the mouth. Okay, little dangly thing at the back of the throat is called the uvula. That'll be their tongue that you're trying to push out the way. Their tonsils sit on the side here and here. Okay, so little pockets on the side of the throat, that's for their tonsils. Make it easy for you, I've coloured them in. Now, when we look at tonsils, we talk about grading of size. So when we look at these tonsils, what we're looking at is the distance from side to side versus how much the tonsils fill in that space. And we break it up into grades. So this is what we call a grade 1. So a grade 1 tonsil is where it fills up to 25% of the space. Most of the time, grade 1 tonsils don't cause much in the way of breathing problems. Then we move up a level to grade 2, up to 50%. So more than 25 and then up to 50% of the space is occupied. Now, sometimes these can cause problems and sometimes they don't. So if you see these sorts of tonsils, it doesn't mean things are okay, but it also doesn't mean things are a problem. This is where a specialist needs to get involved to try and work things out. As we move up the scale, we get to grade 3. Grade 3 is beyond 50 and then up to 75% of the space. And as we go up in grade, they are more likely to cause problems. And it doesn't just have to be with their breathing, it could be swallowing. We see kids that have trouble swallowing, they'll choke, gag on food, they'll chew meat but then they'll spit it out because they can't get it down. So from that point of view, it's worth knowing that big tonsils can cause different problems. And then the last one we've got here are these ones, these chunky little babies here. So these are grade 4 tonsils, so 75% and beyond obstruction. These ones can actually get so big they touch each other. We call them kissing tonsils. When you see this, some children actually have big tonsils like this and they don't cause any problems. But that's what a specialist is for. So take home message for today. Kids not supposed to snore, so don't ignore that snore. If you think that your child does have a problem, then best to get an ENT to check them over, and best to be done sooner rather than later. I'll come up with some more videos. I hope you like this one. Any comments or feedback you've got, or questions that I can do other videos for, always open to feedback. Have a good day.